Well, hi, it's Rebecca Gordon again with Gordon Marketing. Now, hopefully you've already watched my 4 videos on really getting to understand the Affordable Care Act or Obamacare. Well, now we are in the beginning of September and the train is coming to a stop. October 1st is going to mark open enrollment. So I'm going to go through a little bit about what we know, and then I'm going to talk about what we need to be aware of, as well as where some of the big opportunities are. So if we recap on some of the things that we know. 1, open enrollment is October 1st to March 31st this year. They have announced that for next year, open enrollment is going to mirror the annual election period, or AEP. So awesome. If you're in the senior market and the health under 65 market, now you have 2 competing markets at the same time. We know that all policies with a 2014 effective date will be guaranteed issue. So any business that you write during open enrollment will have an effective date. The earliest effective date is January 1, 2014, guaranteed issue. So now the only way that a carrier can determine your rate is based on your age. If you're a smoker, and this is a big thing, because if you are a smoker, it's going to be based on the honor system. So I predict the whole country will become non-smokers. You should admit if you are a smoker, and if you do, it's a 50% surcharge. And that should go for Nicorette gum, patches, anything. If nicotine is going into your system, you're a tobacco user. And then they also can rate you on your geographic region. So before, we would rate people based on their zip code, where they live. So here in Indiana, typically Maryville, which is the northwest pocket of Indiana, right outside of Chicago, is going to be more expensive than, say, Jeffersonville, Indiana, which is southern Indiana next to Kentucky. So now your states are going to be broken up into different regions. And in Indiana, we have 17 regions. This isn't a big deal. The price differential shouldn't be that big of a deal. But that's it. That's how we're going to rate people. And it's called community-based rating. So it's guaranteed issue. You can buy insurance really from one of 3 spots. 1, Medicaid. So the government wanted all the states to expand Medicaid so that if people made less than, I think is 100% of the federal poverty level, they could get into Medicaid. So traditionally with Medicaid, you could only get in if you were a single individual with a kid. But now you just have to be a single individual. So the government's expecting millions of people to qualify for Medicaid by expanding it. So that's one way. 2 would be the marketplace and or exchange. It means the same thing. We started off calling it the exchange, but they couldn't translate it in other languages, so now we call it the marketplace. So you can buy it in the marketplace, and the only reason someone would go to the marketplace for their insurance would be if they think they're getting a subsidy. So they believe that they make somewhere in that federal poverty level, which is about 133% and 400%. If you fall within that guideline, you should qualify for a subsidy or a tax break. If you are going to sell or enroll people in the marketplace, you have to be certified, right? But what you need to know is, depending on what state you're in, you either have to be certified on the federal exchange or a state-based RAN exchange. So for example, Indiana decided to have the federal government run our exchange, and so did 33 other states. So by going on the federal exchange, which is medicare.marketplace.learninglms.com, and you can email me and I can send that to you because I might be a little off. If you go on and take that course, which is about a 4.5-hour course, right? You're going to take 2 tests, and then you're also going to have an ethics part, and that's just phase 1. Phase 2 hasn't been rolled out yet. I'm sure any day it will be, and it's not supposed to be nearly as intense as phase 1. But that will certify you for all federal exchanges. However, if you want to sell in states that are not on the federal exchange, then you have to get in touch with that state and find out what their criteria is. They're able to make up their own criteria. So We know open enrollment's coming, right? And you should play in this market. This is a huge market. Of course, they say there are 35 million folks uninsured. Well, not all of those people are going to buy insurance. There's a big chunk of those folks who can't afford insurance now, and they're not going to be able to afford it in 2014 when the prices go up. But we are going to talk about where I really think the sweet spot is and where you can tap into a lot of potential. We know everything's guaranteed issue. We know you can either buy it on the marketplace, you could get it Medicaid expansion in the marketplace, or the private sector. And you're not going to see the same players participating. So Assurant Health, they're not going to be on the marketplace, but they will be in the private sector. Anthem, the WellPoint states, they're going to be on both. Golden Rule, they may only be in the private sector. So we're not going to have necessarily, I think, the competition we thought we'd have, but it's good to be contracted with the big three. Look for my next video. It's going to be video number 2, and we're going to talk about the small group industry. Come back.